There is a stigma associated with mental health issues. There's a stigma associated with ketamine. Okay, let's break those down. Let's understand what it is. Let's not shy away from it and not have the conversation, because maybe it can save not just your life, but maybe the life of a loved one.
Hello, everyone. Welcome back to the channel, or welcome to the channel if you're new here. I am delighted to have with us today Dr. Anita Bangale. She's an emergency medicine physician, a mindset coach. She's done telepsychiatry for quite a long time and now has a ketamine clinic, which I can't wait to hear more about. And before we dive into that, Anita, thank you so much for joining me today.
Thank you, Jillian. I'm excited about our conversation.
Me too. And for the people who haven't yet had the opportunity to meet you, can you share a little bit more about you?
Yes, so I'm born and raised in Texas, and I've been here most of my life, apart from my training in emergency medicine, which was at GW in DC. And then I came back to Texas and have been in the northern part of Houston for the last 13 years. I fell in love with emergency medicine when I worked as a scribe at the end of my college years, and I loved how emergency medicine actually gave me permission to be imperfect, because up until then, I felt like I had to over prepare and know everything about what was happening and overstudy for exams, for example. And in emergency medicine, I walked into the ER and you realize you couldn't predict anything, you couldn't study, and you just had to almost build in this layer of confidence in how you took care of the patient. And I love that about it. It was so freeing. And so that's part of my story as to why I love the ER.
It's so fascinating. It's like this self-prescribed intervention. I know that my tendency are to overthink, so I'm going to put myself in a situation where that's not possible.
Exactly. Yes. I think it's only looking back that I realize that's what I love. That's why I
Mhm.
fell in love with it.
And what did that relieve you from when it comes to, I'm a huge, I think overthinking and the perfectionism, it's so draining, but so addictive.
Yes.
How did it support you in kind of allowing yourself in some aspects to free yourself from that?
It's interesting because I read a lot about how in entrepreneurship, there's like three different personalities. And one is somebody that's very financial, which I'm like, or like detail oriented, which I'm not. But then the other two, I think I struggled with in terms of a yin and yang growing up. Like there was this artistic part of me that I think I suppressed because it was so imaginative and so expansive that it was hard to contain. So it was easier to be this like type A perfectionist type of person where you're either memorizing, spitting out the right words, writing the essay in the right way. So much of it focused on external validation. Whereas like with creativity and artistic expression, I ran the risk of maybe other people wouldn't like it. Maybe it wouldn't be deemed great or beautiful. And so in emergency medicine, I feel like the more creative you could be in figuring out solutions that maybe weren't in the box, right? Thinking out of the box is actually rewarded and considered to be a successful characteristic of an ER physician. I think that's what I realized I could blend those two things.
That's beautiful. And for all these physicians, and I've had some people come on the channel that are physician artists that lost their artist connection. Just sounds like that creative side that you were missing during medical school when it was important to kind of just focus in and that people could judge. Like there's no real objective criteria for art, right? It's a very
Right.
subjective experience. And so we have to fit into a box. And often people will say, like, oh, well, I gave up art because I thought it was taking away from my study time.
Hmm.
And
Hmm.
only in adding it back do we realize that it was important we hear a lot about burnout mitigation or making sure that our identities are more diversified. And we were speaking a little before we started about the importance of maintaining hobbies and how we lose that as
Yes.
adults. Would you mind sharing a little bit more about your perspective on that?
Yeah, for sure. I think it's something that I had lost that connection to my hobbies as especially in residency. I think because it was just so much effort and so much time and so much energy use that goes into residency that there was little time to tap back into my hobbies. So I read and researched this topic called social prescription, which is a way for us to connect with each other, so other people, so social, and then tie that into our hobbies. So things that we probably did in high school, but probably we lost touch with it because at that time we were doing it, it was maybe a way towards another end, right? Like for an application, to get into college, to satisfy volunteer requirements. But maybe there was some part of it that you were really passionate about, but we kind of forgo that because the ends to the means is done. The application is already, filled out. We already got the position. We already went to medical school. And so sometimes as adults, I realize that so many times people lose that sense of passion. It becomes so technical, so checkbox, our day-to-day lives. And it's because we're not achieving that social connection, that social prescription, not just hanging out with friends, but doing the activities that we truly love and that bring us joy.
Mhm. And there's so much about the epidemic of loneliness now. We have
Mhm.
the epidemic, with burnout. A lot of people, this whole channel is about helping people to find their way back home to themselves after the years of abandoning those aspects of ourself. And it's so fascinating that we learn it so young that our CV should be full of things that other people would find valuable. I
Right.
remember in high school, I quit basketball because I'm 5'4", and I perceived that my height and my lack of passion. I went to this basketball camp, which was fun, but all the other people that went, their families were there, and it seemed like they were much more devoted. So I came
Mhm.
back and I quit. And like looking back, I wish that somebody would have modeled for me what it looks like to do something for fun.
Yeah. Yes. You're so right. You're so right because you felt like you almost like your family had to be a part of your passion, right? These other people's families were there, it sounds like, and that made their passion more credible, I guess. And for you, it was just within you, and that wasn't enough. And so you quit. I think that happens so many times. And I think, especially in early motherhood, is when I realized that I had reached this tipping point where I was like, okay, I'm giving and I'm giving and I'm giving. And I enjoyed that part. But I was like, "Well, this can't be the whole rest of my life. Like, how do I fuel myself again?" And that's when I realized, like, okay, maybe I start taking a dance class again, things that I did back in the day, but it wasn't part of that moment anymore. And the more I started doing that, the more I realized, like, I was a better physician, a better mom, better friend, better wife, and all these other, other parts of my life just because I was actually doing the things that brought me joy.
Wow. I think that's a really important point to highlight because time after time, every single client that I've talked to, I feel like there is this seeking to reconnect with themselves and also to provide them permission, to provide themselves permission. And ultimately, I think that permission comes from accepting what you just said. Like it makes me better at certain aspects that we think initially, if I allow myself to take care of myself and embark on these things that I find fun, it will take me away from those things. But what you just said was that it actually allows you to be, was it more present, more, what is it? What comes up for you?
I think in a short phrase, less resentful
Mm-hmm.
and therefore more able to enjoy the moment in which I was serving others without feeling like I was taking away from myself because I realized that they didn't have to be separate entities. Like I could still give to myself and give to others. And if anything, one fueled the other. And and so I was able to actually be in those other roles without feeling like it was taking away time from other things, right? Like, I could be at work, and if I had to stay extra to chat with the patient for 20 minutes, I wasn't sitting there looking at the clock like, "Oh my gosh, this is taking away time from other things I need to do."
Mm. Thank you for that. I think that's going to really resonate because I hear it a lot about even people are afraid to admit they feel resentment. especially when it comes to, being a mom, and they're like, well, I feel guilty to say this, but allowing ourselves to admit the feelings that we're having and
Mhm.
to say, well, what needs to be true in order for me to reduce this resentment? I really need to engage in the things that I feel like I'm losing right
Mhm.
now.
Mhm.
And because I do trust that that's going to really resonate with so many people, what kind of advice would you give those people who aren't really at a place yet in their mind to even allow themselves to explore what it could be like to honor what they're truly craving inside?
I would say go back to a time where you didn't feel that resentment and think about what a day in that life of the previous you looked like. Because we all probably feel resentment because our expectation is something different than what is actually happening. So maybe it means that we've experienced something different that we want to recreate again in our life. So, what does that day look like? Who were the people that we were with? What were the activities we were doing? And I feel like, what is one step that I can do today to recreate some part of that day, some moment of that whatever the endorphin release I was experiencing then? How can I recreate that today? Maybe it's a 5-minute walk. Maybe it's calling a friend. It doesn't have to be something that where you have to travel to Bali or spend a lot of money or time.
Mhm.
Like, it can be something really simple, but I would say think about different moments and what was the common link? Was it a certain friend? Because with like you mentioned with the loneliness, sometimes we're just doing and going about the day in such a lonely way
Mhm.
without sharing those moments. And sometimes maybe it is just about connecting with someone else or trying to reach out to somebody else with somebody else, and then going to the yoga class, doing the small thing that maybe back in the day brought joy.
Mhm. Yeah, and I think it can really be helpful. You start connecting with people, and sometimes people, it might be more comfortable to connect with an unbiased party. And I know that you're a coach. Is that a type of coaching topic, or can you share? Is that if someone really needs support in leaning into that, is that the type of client that might be working with you in coaching?
Yeah, I would say, generally I'm a life coach. A lot of times the topic that comes to mind that we get down to is confidence coaching and people having enough confidence in themselves to create the life that they want. And a lot of the coaching that I do starts with values and ends up because that's the core, right? But people a lot of times feel like, yeah, well, I have all the values, right? Like I usually like to start with Brene Brown's list of
Yep.
the values and like having people narrow down what are their three top values. And it's really hard. It's a challenging exercise because people feel like they should have all the values.
Mm-hmm.
But
Yep.
again, it's giving permission to be like, it's okay to choose a few that are higher for you. It doesn't mean that you're a bad person, right? Just because, like,
Mm-hmm.
maybe, I don't know, loyalty may not be the highest one for you. It's okay. You
Yep.
can still be a loyal friend, but maybe something else is a little bit higher.
Mm-hmm.
And so a lot of it comes down to that confidence in being able to know yourself
Mm-hmm.
and present yourself to the world in that way. So I don't know if that answers the
It
question.
does. Yeah, it does. It does. And I think it's funny, the confidence you'll notice on this channel, I just there'll be a video on confidence, and I'm going to ask you the question that I answered for what I think in the video. What does confidence mean to you?
Confidence to me means being able to walk into the room and not have to change a thing about who you are, regardless of who there is in that room. And you do that 100 times over and you enter the same way because you're not changing anything about who you are and how you're presenting yourself and how you're showing up based on the other side.
That's amazing. I know so many people are they're searching for that, right? Like I lost myself somewhere. I don't know how. I think a lot of times with life and career transitions, we lose ourselves, our identities reshape and form. So I'm going to share a link to your website and to your coaching down below. So anyone's like it during those times when we do feel lost, I personally find it so important to talk with somebody, and also talking to somebody who is not biased and who you're not afraid to say those things. My values aren't like there are times where those values that should be on there aren't. And are you going to express that to somebody who you feel might judge you by working with somebody who comes in with that non-judgmental, like no skin in the game from that end? I think that's really
Exactly.
helpful.
No, I think everyone should have a coach. Like, I think it would be amazing if insurance companies or plans or employers or however you want to organize it. I just think it'd be amazing for everybody, especially starting in high school, for everybody to have a coach. Like, people have, college counselors, they have athletic coaches, but we don't think about a life coach. And I think in those high school years, as those values start to emerge, but people want to maybe suppress them, I think that gaining even 10% confidence in your high school years would go so far in the trajectory of your life in showing up how you want to show up.
Mm-hmm. Mm-hmm. It's so true. Yeah, running, actually a running coach, I know it's different than like other coaches, though it can be similar. There's some performance-based coaches. I wish I had a mindset coach in running. It actually would have helped me a lot with my performance anxiety. But I
Mm,
do remember the importance of coaching and having some sort of person that believed in you and developing confidence. And for people who don't love athletics, having some sort of mentor or coach, I think also just to support what you said, I think it's really helpful.
yes, because they
And
just want to, and they believe in you. Sometimes I feel like it's almost like borrowed confidence. You are able to tap into your own confidence because you know someone's reflecting it back onto you. And so they're not giving you anything you don't already have. That confidence that they're reflecting is something you have inside of you. They're just helping you see it.
it goes back to I know you did your TEDx's in like the masking of a lot of the times when we show up in a way that fits the context of what people expect with us from us in that area of life. We
Mhm.
can, like you suppressed your creativity in terms of your artistic sides, and some of that came out when you were doing in the emergency when you were practicing emergency medicine. Um, and now I think anticipating like how that also exists as an entrepreneur. Can you share more about your TEDx conversations and some of the takeaways from that message, which will also be shared in the link down below
Yeah,
so people can
sure.
listen to the whole thing?
So, the first one that I did in 2021, so it was kind of around during the COVID times, right? And not necessarily the peak of it, but it was kind of going up and down around that time. And I talked about the power of de-armoring ourselves despite having armor on, like physical armor on, in the sense of having PPE and all the different layers that were preventing us from really connecting with our patients, especially in the emergency department where people were already guarded
Mhm.
because of, for various reasons. And so, how do we actually connect with each other when there's all these layers of all these barriers? And it comes down to storytelling and conversation. And that was kind of the heart of that talk, is just really being able to share that human element with each other. There's no power play. There's nobody that's even necessarily right or wrong. It's really just a common source of inspiration, right? Like, I felt inspired from when I heard my patients' stories. Perhaps they felt inspired in hearing the medical advice, or just the social advice, or whatever they came in seeking. Because a lot of times I feel like the patients I truly connected with, it was not based on my charting. It was not based on the medicines I specifically prescribed. It was really based on those conversations.
Mhm. I think that's such a big part of the healing modality that's being stripped away from healthcare right now,
Mhm.
and why it causes such a moral injury on being the physician and also the patient. The lost humanity. It's very, a lot of people say that it is associated with high traumatization when we are treated like we're not human.
Yes. Yes. I mean, we've all been there, right? Even as physicians, when we are the patient and you walk into an office and someone's getting your vital signs, not even making eye contact with you during that part. And you really don't feel like you are a human, and you just feel like you're being herded around. And just And of course, like in the ER, there's always an excuse. It's because there's 50 people waiting to be seen. There's 50 people waiting in hallway beds. It should be upstairs. But still, I mean, I just still, the artistic part of me felt like, okay, well, can we still, can I personally create some other model to be able to take care of patients the way I want to,
Mhm.
and the way I would want to be treated if I were a patient? And I think the answer is yes. And yeah, it takes some level of I guess courage and just to take that leap of faith in believing, but it's again believing in the humanity of it.
Mhm. Yeah, which leads greatly into my questions for you on what you have created and why ketamine.
Yeah, it's interesting because I have a psychology undergrad degree, so I've always been interested in psychology, the way that we think and behave and interact with each other. And I found that over, the 19 years in emergency medicine, I was always fascinated by the patients that came in with either major depressive disorder to the point of suicidal ideation or suicidal thoughts or suicide attempts, um, and patients that had such severe anxiety that they were having chest pain. I think having not suffered with anxiety or depression, it was just something that I couldn't understand how something could manifest in such a physical way, right? Like initially it was just like such intense curiosity because I didn't understand how can this present with chest pain where people literally feel like they're having a heart attack. But I just remember talking to so many young people and I just remember feeling like, gosh, like there has to be something that can be done. And I felt like the patients with major depressive disorder who wanted to hurt themselves, they were doing the opposite of the work we were trying to do, right? We in the ER are trying to take care of people, save their life. These people didn't want to be saved.
Mhm.
So I felt like we know what to do in septic shock. We know what to do in cardiogenic shock. We knew what to do with the STEMIs. We knew what to do with all these critical cases, but we didn't know how to help people when they felt like they didn't even want to be alive or help themselves anymore.
I find it fascinating as someone who cannot relate to the inability to relate to these people, where I'm like, wait a second, you don't have crippling anxiety. You don't, because I relate to your patients, where
Yeah.
I would be, well, so anyone else who relates to the patients, you're with me. And for all of us that are curious how you can ground yourself so that you don't feel the anxiety and depression. I'm curious also to know more about your life and what you think has helped you to have that perspective where you weren't actually able to relate, but you were curious to help them.
Well, I think I just thought about it where it, they were seeking help, but in the ER, I just felt like we couldn't help them. And I didn't like that feeling because I felt like we could do CPR on all these people, but there was no CPR for the mind. The
Yeah.
more I started learning about how ketamine works for patients with either treatment-resistant depression, anxiety, bipolar disorder, I realized that that was essentially CPR for the mind. We could do actually other things instead of and work relatively quickly, right? I mean, that's part of my desire and passion in the emergency department is to see fast-acting results. And then the more I started reading about ketamine, I realized that, hey, within a few weeks, even sometimes within a few doses, people can feel like their life is transformed. And and so it was a perfect intersection for me of the telepsychiatry that I'd been doing for the last 8 years, working specifically with patients that have anxiety and depression, the emergency department where I was using ketamine, but in a different way, right, for sedation um, or pre-intubation. And then, but to be able to use this medicine I felt comfortable with, but in a totally different way, with such lower doses where I knew, okay, this is safe. Let's actually see if this medicine can do what these reports say that it's doing to people. And so it kind of blended everything together and gave me the ability to again take care of the human side of patient care, like to really connect with patients, hear their stories, make sure that I had enough time to listen.
Mm. And for the people who they've heard of ketamine but not quite sure how it works, can you give a little bit of an understanding? What is
Yeah,
ketamine and how does it work?
sure. So initially it was created as an anesthetic like 50, 60 years ago. So it's used by anesthesiologists like in surgery to be able to help people to sleep. But about 20, 25 years ago, there were these anecdotal stories where people would start getting doses of ketamine for some other procedure, and people that had depression or anxiety, their symptoms would actually improve. And so some of the researchers at Yale about 20 years ago started really studying this more aggressively, and they found that at low doses, ketamine actually works on a different neurotransmitter than most of the oral medications that we have currently. And it's probably one of the fastest acting antidepressants available on the planet. And the reason it is because it works on glutamate. And that's a neurotransmitter that a lot of the oral medicines don't work on.
Mhm.
And because glutamate is involved in about 80% of kind of our chemical emotional reactions, that's why it works so quickly. Because as opposed to SSRIs, which work on serotonin, and that's maybe only present in 10 to 20% of the neurotransmitters in the brain, it's obviously going to take more time when you're only hitting 20% versus 80%. And so that's part of the reason that it's so cool. And I equate it to people are like, well, it's an anesthetic. And yes, but like let's think about eggs for a second. So if you if you fry an egg, it turns out totally differently than if you bake it over 45 minutes in the oven with other ingredients. It can turn into a cake and helps things, rise.
Mhm.
So the same ingredient can have different properties when it's given at different doses and over a different length of time. And that's why ketamine has so many different properties based on how you're giving it.
Mhm. And you were saying for anxiety and depression, what's kind of the reasons why people would come into your clinic for this ketamine?
So it's for really, the indication is for treatment resistant mood disorders or anxiety. The best data is for treatment resistant depression or even suicidal ideation. I mean, I had one of my first patients actually was this like a mid 40s-year old lady that came in and she literally had a plan, did not want to live. I told her she was in the car, her husband was driving, and I said, you need to go to the closest emergency department. I mean, it was pretty acute. But she just wanted to come and see a physician. She didn't want to go to the ER. She was a mom of two, and her husband drove her to our office, which is actually 45 minutes away from where she was at the time. I just wanted to buy time. My plan was call 911 as soon as she comes after I like kind of help de-escalate things a bit. And in talking to her, I realized that okay, she wasn't as critical, but she was amenable to ketamine infusion treatment. She did a session. She felt better. She contracted to safety. Still told her husband, "I'd recommend you go to the ER, or intake in a facility." She promised to come back 2 days later for another infusion, and four sessions later, she was feeling so much better. She did the total of 6 over 3 weeks, and she ran a marathon. It was like baking bread with her kids, riding bikes with her kids. I mean, it was just so transformative. She says without it, I mean, she doesn't know if she'd be here, but it saved her life.
Mhm.
And so it's just amazing.
And it's beautiful to have that conversation because we know, it's important to keep people safe, but the emergency room can be quite a challenging place for people who are having suicidal thoughts and then are left there without human contact or are isolated. Like there can be some aspects of that experience that are less helpful. So I'm always curious to know,
Mhm.
when we're approaching that. And I don't have all the answers to this. I do know keeping people safe is very, very important. And also have been in an inpatient locked unit myself for a month for my eating disorder and know the repercussions of having had that experience and how it impacts me today.
Mhm.
Um, and just thinking about when people are feeling like there's no hope and to have that glimmer of some relief from the brain. Like I would call it, for me, it's psychic, just like so much pain,
Yes.
just have some sort of break in that, some sort of relief to say it's not always going to be this way, because we can develop, and I know you already shared, you did all this, but just for the audience, like we can develop a state dependent recall where if we're in that mood, we think everything has always been that way. It's always going to be that way. And so if you can break that deep, dark mood, then that person can have that glimpse of, I am in a more optimistic mood, and I can see that life doesn't always have to be as much suffering as I was just in, and can give us that glimmer of hope of like, okay.
Exactly. Yes, because the two things on that. I think for, in my second TEDx talk, I talked about this 14-year-old that was stuck in the ER for 2 weeks because they were waiting on an inpatient psych bed. And it just broke my heart because he came to know us and other staff members by name because he was there for so long. And that's just not a way to exist. That's not a way to take care of people.
Mhm.
No, we don't do that for heart attacks. Why do we do this for like you said, psychics? It's There has to be a change. And I just couldn't stand to see these young people like it again and again in all the years. Like I would just have so much curiosity with these young patients because I'm like, gosh, you have so much to live for. We have to change something in the way that we're taking care of these people. And that's why I just think the more people know about this as a treatment option, again, it's not the right medicine for everybody. There are, risks with it, but if it's the right medicine for you, just know that there's maybe hope, even if 5 oral medications haven't worked, even if 10 oral medications haven't worked, even if you've had depression for 20 years, just know that there could be a medicine that could work for you. And again, like you said, that glimmer of hope is all we want to have people have, right? Just to hold on for another day, ask another question, have another experience to be able to hold on.
Mhm.
Um, and then the other piece of that is with ketamine, like you said, it does transform the lens in which you see life because it works through neuroplasticity, which is our brain's amazing ability to just keep growing and expanding and changing literally up until the second we die. And to know that there's a medicine that can help us break that loop. I always think of sometimes maybe depression and anxiety, especially, it's kind of like it's almost like a habit, right? The brain gets used to thinking about things a certain way, to seeing life in with a certain pattern. And if we can change that, if we can short circuit that and make sure, hey, there's another alternate path in which we can start to see life, and we can really cement that down to be the path of least resistance for us to see life,
Mhm.
maybe we'll start seeing things with more rose-colored glasses, and maybe that is the solution. And so knowing that there's a medicine that can have the effect of neuroplasticity, I think that's so artistic.
Mhm. Yeah, it's like that catalytic event in marriage and family therapy. We talk a lot about, like, there's in Virginia Satir is one person who has some theories of psychotherapy and or family therapy. And there are some models that I want to highlight here because it seems like ketamine can play such a good role at this, is if we're having these negative interactional patterns between people or even within our own self, having something that breaks that pattern, like you said, whether it's
Mhm.
just in Virginia Satir's model, she calls it the foreign element, but it's just that one thing. And I struggle a lot with a lot of OCD type of traits, and so mine, it's very like, if I don't do something very consistently, even if it's causing me distress, then not doing it causes me more distress. But I realize that those things change a lot, so I'll develop new patterns, and then those new patterns become the patterns that I have to repeat. Right? So it's like it's very fascinating, where I can see for personally the benefit of breaking something that's causing you a lot of distress, just to get your mind, and leveraging the word, the creativity that you had, is getting the mind to explore other possibilities. And for me, when I was in a dark depression, just having someone invite me to explore things from a different way, when it seems obvious when you're not depressed, but when I was in that, I like, my brain was black and white.
Mm.
I speak to a lot of people with their trauma experiences where their brain was very rigid, black and white. And so inviting them to expand and have a different perspective can, like you've demonstrated, be life-saving.
Yeah, I think that's And I think it just allows you to have the hope.
Mhm.
And I think part of it is, people say maybe it's a placebo effect. I mean, the data shows that it's not placebo effect. But let's say even with the first dose, maybe that what if there's placebo? Okay, why not?
Mhm,
I
mhm,
just think if that's part of the bridge to be able to really see the therapeutic benefit from a treatment like this, then hey, I'm all for it still.
mhm. Yeah.
Um, but when you were in that, inpatient in your major depressive episode, was ketamine ever considered as an option?
I needed food. I was very malnourished,
Mhm,
and actually being nourished relieved my depression at that
mhm,
time.
mhm,
My issue is I still live with anorexia, so I notice that when I am in an energy deficit, the depression comes, and I, just like you were saying with the patients who come suicidal to ED, but also like sometimes I can develop this level of apathy. Well, if you're
mhm,
apathetic about treatment or you're too depressed to get treatment, it becomes a catch 22.
mhm.
So there are some research people are telling me things. So I haven't looked at ketamine in particular for anorexia and PTSD, but with the psychedelics coming on board, I imagine ketamine has been in some clinical trials for PTSD. I just don't know for anorexia. So you've made me curious.
Yeah,
And
well, I did speak with somebody and that was in an eating disorder clinic, a couple of patients actually, and they had been recommended ketamine in their inpatients during their inpatient stay,
mm,
which I thought was fascinating because again, it's like breaking that loop,
yeah,
breaking that cyclical nature of thinking and the
mm,
pattern that's been set as the baseline.
yeah. I think at that time the pain was so severe, I would have certainly tried it when I
Hmm.
was a patient. I kind of wish it was offered because then I would have felt I was in a safe container. And I know you keep patients as safe as possible as well. And
Yeah.
I'm curious about two things. You were saying some contraindications. Who is ketamine not for?
So if you have if your blood pressure is uncontrolled and very high, then that would be a type of patient that we would not that we would first want to get your blood pressure better controlled. If you have any history of some type of neurologic mass or some type of history of a brain hemorrhage, then we would want to avoid ketamine. The reasons are that ketamine can, during this treatment session, physiologically, ketamine can increase your blood pressure. And so it's almost a sign that the medicine is infusing. So we don't want to increase already high blood pressure, and we don't want to increase high blood pressure, especially in somebody that has any brain issues, any neurologic issues, because we don't want to have any other negative side effects or potentiate some other consequence from that. But also, if there's any history, there is some evidence that ketamine is quite helpful in patients that have substance abuse history. In my personal practice, I don't take anybody that has any active substance abuse history, either now or in the past, because I mean that's my personal preference. But there are some clinics where you are able to go, if there's any specific issues, whether it's alcohol or other substances. Um, the other issue would be if anybody is taking benzos, like benzodiazepines, multiple times a day. Again, because that can worsen or the effects of ketamine on people. And we want to make sure that this is like a single variable in your life,
Mhm.
And so people are supposed to continue taking their antidepressants. This is just an adjunct in the treatment of depression and anxiety, especially because it's only the like induction sessions are only happening over 3 weeks. It's too soon to make other changes rapidly to oral medications. So
Mhm.
this is like one variable that's happening at a certain time, and then you still meet with your therapist or psychiatrist to be able to then see how we can taper down the other medications. But we stay in touch with therapists or psychiatrists or primary doctors to be able to help coordinate that care.
Mhm. And for those people that are interested, can you kind of highlight, you said the induction happens over 3 weeks. What would they expect if they say, yeah, I want to try this out?
Yeah, so we send you our clinic information. We do an initial consultation to understand kind of the history, to understand your goals, so that we can just be on the same page and understand how we can truly help and make sure that um, it's a good fit on both sides. And then we schedule the first couple of sessions, and we go through and make sure that they have somebody that can drive them. In a way, it's nice because all the patients, they're not able to drive. So usually they have a friend, neighbor, family member, somebody that comes with them. And it's also part of that social prescription of their healing, because that means that there's actually usually at least a couple of people in their life who know that they're going through this experience, questioning them about it, asking about how they're feeling, seeing the improvement with them, really joining as like kind of their celebration parade in helping them really recover from some of their symptoms. And so it really lends again to what I think is that social connection piece that's so important for healing. But yeah, then we go through and schedule, and then we have a evidence-based protocol where it's weight-based, and we have continuous monitoring throughout all the sessions. And we do at least 30 minutes of therapeutic communication with every patient at the end of their session to make sure that it's not just a medicine. It's not a treat and street type of situation. We want to make sure that we talk about, we analyze what they were able to experience during their ketamine infusion, what they can pull away from that, what thread they can pull from that back into their day to day life, and how that can help them overcome some of their issues.
Mm. How long are each infusions?
So the first one is 2 hours, and then the ones after that are about an hour and 45 minutes for us to do everything.
Nice. And then after the infusion, what do people expect when they go home? Like if they're having a job, do they have to take some days off, or what does that look like?
Yeah, so sometimes, so we say no driving until for at least one sleep's worth of time. So if you have an infusion 9 a.m. that morning, you can drive the next morning. If you have it at 4 p.m. that day, you can still drive the next morning.
Mm.
Um, for some people, they're able to take off work for half a day and schedule something in the afternoon. But yeah, we definitely recommend no major activities for the rest of the day. For some people, they're drowsy a little bit or sleepy, so they may go home and take a nap. People tend to sleep very well following infusions. We incorporate a lot of this, like a sensorial experience. So we have certain music that we have them listen to help. It's kind of expansive and helps people tap into this deeper space in their mind. We have certain oils, certain scents that are associated with this feeling of relaxation. And we encourage people to recreate that at home. Again, to cement that pathway of that neuroplasticity and really use the experience in the clinic as a catalyst, and then like really solidify that at home.
Mm. It's so beautiful. I know from your TEDx talk and talking with you once previously and now today, what really comes out is that dedication to humanity and just really caring for people at such a deep level. And I think that really differentiates. I haven't been around a whole lot of people that provide ketamine, but to hear that side of things being alongside this ketamine, I find it to be so important and so valuable. And so for patients who are hearing about this, or for physicians who are hearing about this and they want to get in touch with you and explore more, what's the best way that they can find you?
Yeah, so either my website, which is anitabangale.com, so just first name, last name.com, that has some general information, easy way to contact me, or through Instagram, which is my handle is at Anita underscore Bangale underscore. Um, and I'm happy to always connect with anyone that has questions um, in those ways, because so much is about, I just don't want people to have a fear of asking questions, right? There is a stigma associated with mental health issues. There's a stigma associated with ketamine. Okay, let's break those down. Let's understand what it is. Let's not shy away from it and not have the conversation. I'd rather answer your questions and you still feel like, oh, this is weird, but at least you have the information.
Yep. Mm-hmm.
So let's just have the conversation, because maybe it can save not just your life, but maybe the life of a loved one. Because, like, for that mom, she now has two kids who are thriving because they have a mom that's thriving. And there's no there was no other solution for her at that time, because she had tried so many other medications. She'd gone to psychiatrists, she'd gone to therapists, very proactive in her life about getting help. And for some people, this just happens to be the medicine that works for them. So just be open to it, open to asking the question.
Yeah, and if you want to ask your questions, I know some people will want to do it privately. If people ask the questions down below, we might have to have Dr. Bangale on here again and answer some of those more widespread. I'm sure people will have very similar questions, but if not, of course, I'll allow them to ask you directly. And you gave so much in this very meaningful conversation, and I'm curious if you have any last takeaways you'd like to provide with the audience.
I would say, you know, I think the biggest takeaway is, and I think I really started feeling this, especially after I became a mom, is that there's only one of you, right? You serve a purpose. You may not know what it is, you may not see that, but you do. And I think it's important for people just to know that, just to have that assumption. Again, don't believe it if you don't want to, but just assume that it's true and try and go through life to try and maybe find that purpose, or to identify it for yourself in the way that you want to see it. It doesn't have to match up with anyone else's view of your purpose. Just create your own purpose and use this life and the experiences to be able to create that for yourself. And so it just wouldn't be the same without you. So we have to have you.
That was so beautiful. I don't want to say much more because I don't want to take away from that very powerful message. But thank you so much for being with me today.
Thanks, Julian. Thanks so much for having me.
And for the audience, if you want to share any of your questions, your reflections, your insights, please do that down below. We'd love to hear from you. Thanks for being here.